For a hospital that is usually teeming with patients, the slow traffic at the casualty is very unusual. The departure of the doctors on training has left the hospital in near paralysis. They are protesting the suspension of their colleague involved in the brain surgery blunder.
They withdrew their services because their teachers, who happens to be dons in the University of Nairobi, and they happen to be doctors, went on strike on the 1st of March. Their fear is that if they continue functioning in Kenyatta without their supervisors, and such errors occur, who will protect them?
The doctors on training offer 85% of the services in the hospital. Likewise, their peers at the Moi Teaching and Referral and Mathare hospitals have absconded duty.
Now that they have withdrawn their services and we are running with a skeletal staff of only 15%, we will just be forced to withdraw elective clinics. We will be forced to withdraw elective theatres because we cannot handle the emergencies that come to Kenyatta.
In the midst of an outrage following the patient mix-up, the doctors say the mishap has ignited a campaign for efficient health systems to avert a repeat, even as the system's audit into the events that led to the blunder begins.
An issue of mislabeling. What do the developed world do? They have barcodes that they tag on the patient. All that is captured within what is called a PACS system. How much does it cost? A mere 100 million shillings. And I'm saying a mere 100 million shillings because the government of Kenya spent 34 billion shillings in what is popularly known as a medical equipment leasing system.
The hospital, intended to serve 1,200 patients on a given day, is grossly underfunded, understaffed and ill-equipped to cater for almost 3,000 patients it is serving now.
You have one ICU bed, you have 3 patients who are in need of that ICU bed. How do you choose who lives and who dies? We have only one CT scan to take care of 2,400 patients. The requests that are done for Kenyatta for CT scans, even if you are to wheel those patients one after the other one without a minute gap, you cannot finish those requests. We have an MRI that is dead.
The Abuja Declaration, for which Kenya is a signatory, recommends 15% of the country's budget be allocated to health. Currently, the Ministry of Health receives 5% of the budget, a mere third of the Abuja Declaration requirement. The funding challenge bedeviling KNH and other public health facilities was beyond the hospital's management, according to the doctors and a section of politicians who now plan to impeach the health CS.
Only 2 weeks in office, see what the mess is. Supposing she's given another 5 years to stay in that office.
If it's a matter of you thinking that somebody has to take political responsibility, then the minister in charge of health should take political responsibility and resign.
That the wrong head was opened was a culmination of grave systemic errors, according to consultant surgeons. They fear that a second episode is inevitable unless the system is fixed. Sylvia Chebet, Citizen TV, Nairobi.